what we would like to do now is to switch that focus completely to another part of the world with perhaps a different experience and an all more challenging one. And for that, we will turn to Nonyelum NWEKE, who is the Executive Director of the Cerebral Palsy Center in Lagos in Nigeria. She's also a mother of a daughter of 14 years old who has cerebral palsy, and so knows both from a personal and institutional perspective the challenges that are involved. So, Nonya, can I hand the floor to you?
I was trying to sign in with another device to see if the video could play, but okay. I wanted to sign in with another device to see if the video can play. It's a pity you can't see me.
We can see your picture though, which is
that's my picture. Okay, that's fine. Okay. So Nonya, and I'm a mom to a 14-year-old with cerebral palsy. And I live in Nigeria, Lagos, Nigeria. I live in Lagos, an urban city. And I'm going to be talking about providing supports, for children with cerebral palsy in a pandemic. Providing needed support for children with CP ordinarily is challenging in a society like ours, where I live. The only thing is that the pandemic, made it more visible, let me put it that way, and it's made it more challenging. It may be important for me to talk a bit about what we used to have. Did we even have anything before the pandemic? Somehow I'm a bit apprehensive about talking about it because, it will appear as if you want to wash your dirty linen in the public. But then I say that because the neglect, the abandonment, and the total lack of honest intention and efforts by responsible governments who are responsible, by the section of the government to provide necessary services and support for children with disabilities and their families, is like a cancer which can consistently eat deep into our system. And we cannot pretend if we don't talk about a cancer, we can't cure it. So I'm going to talk a little bit about it. We know that most African countries which fall under the developing world have these challenges, and I'm sure most of you are aware of that. The attitude of government is worsened by our cultural belief, on children, how we would look at our children. And we look at our children as investments. So when you have a child with disability, that child is looked on as somebody that's, you're not going to make returns. There will be no returns on that investment. So investing scarce resources on that child, is not something most families want to do. But with education and some changes, people are beginning to understand that every child is a child. But because of this attitude, the government is not really doing so much what it should be. So what did we have before COVID? Before COVID, actually, we had little or nothing. Families have to fend for themselves. When your child has cerebral palsy, like my daughter does have, depending on when you get the diagnosis, sometimes you need to be the one to go to the hospital and insist on getting a diagnosis. And when you do that, there's no structure in place. So you have to take your child to the hospital for physiotherapy. That is usually what is recommended. And physiotherapy oftentimes is bi-monthly, which often lasts for like 20 minutes. Well, of course, you probably spend the whole day before it gets to your turn. So for the mothers who are those often who bring their children, it's usually a time for us to have some form of social interaction. Then when it comes to health, you have to, the hospitals are not free, even government hospitals, so you have to pay. So you find out that if you're unable to take your child to the hospital, public hospital, then you have to access the private physiotherapy clinics, or if you are very comfortable, very wealthy, you get the therapist to come home to work with your children at home. For school, in the developing countries, I speak with a lot of people who are particularly in the Anglophone African countries. Majority of our children are not in school, not because they don't want to go to school, but there are no structures in place for that. So the kind of children you will find in school with cerebral palsy are majorly children on the mild spectrum. That is those who will need little or no support. They probably have speech, they are ambulatory. For the ones who are on the moderate spectrum, if the parents is comfortable, the parents will get support for the child. It has to be the burden of the parents to get the support. And these are not in the public schools, it's in the private schools. So for those who have children on the severe spectrum, of course, we don't talk about schools for that. So maybe that's why I'm just passionate about improving the quality of lives of children in that spectrum, because my daughter happens to be in that spectrum. So we are bothered about getting more therapies for the children. And of course, getting therapies entails you have to find the means yourself. So now this is what we had, and the pandemic happened. So you can see that we had nothing. So the pandemic happening to us wasn't really much. It didn't change anything. The only thing is that, I'm talking for parents of children with cerebral palsy, is that it just it just made it more difficult for us to take our children to the hospitals when and if we are able to. So we're at home with our children. But for me personally, because of what I do, which doesn't represent what the government is doing, I have a center for children with cerebral palsy. Some of them are in the center, some of them have to come in every morning and go in the afternoon. But when the pandemic started, this couldn't start. So how do we support them? I found out that I had to reach some of them at home to take food materials to them, because most of them are not on the poverty scale of the society. So I had to take food to them. Therapies I had to be quarantined with some of my staff. So this got me, thinking, how going forward? So for me, or for those in the developing countries, I'm talking to them and I'm telling them that actually we didn't have anything in place. What we should be talking about is going forward, how do we provide services and support for our children? It's okay to look to the government, but we all know that our governments, they are so neck deep in solving what I call the basic problems. And if we waited for them, we are not going to do anything. And so families, themselves have to think of, what to do with their children. So I now, what I propose is a community-based services, which will be run by parents. These days, parents are getting more educated. So they have understood the problems much better than decades ago. So parents, these services will be managed by parents. So some parents can get trained as therapists themselves, and it's easier to get support when you act as a group. So in that community-based service center, we'll be able to get therapists who will volunteer their services for us, and then some of us get trainings as parents, some of us can become therapists, educationists, and I've met doctors, medical doctors who have children with cerebral palsy too. So we can incorporate them. So we get health services for our children. In as much, then again, there is the question of the fact that the world is shifting against institutionalization. But for us, because of our society, because of the way we are structured, our transport system is not the best. In fact, it's not suitable, for children living in disability, particularly children that have motor issues like cerebral palsy. So moving children up and down every day on wheelchairs, for those who even have the appropriate wheelchairs, and we talk of getting the appropriate transport system, is difficult. So we may have to have boarding facility. I don't like to use the word institution, but that is what it says. But if it's going to be manned by parents, or majorly the staff will be manned by parents, then the fear of abuse, neglect, which is what causes the main reason why the world is shifting against institutionalization, will be minimal. Parents are there, that most of the parents are staff. We will use the advantage of the fact that there's a lot of unemployment in our society. And of course, when you talk of unemployment, most of parents with children with cerebral palsy, particularly their mothers, are unemployed because they have to be at home with their children. So that again, we create employment for the mothers. So they get training, they take care of their children grow with them, and they can go home over the weekend. So while their siblings attend schools, when they finish, they can come and work there. So we kind of create a system that's, we grow as the children are getting older. The facility is growing. So imagine now when there is a pandemic, and we have to quarantine ourselves, have to live in. We won't miss anything, because parents are the ones who are working there, so we can call in support. So it's easier to get support. So so for people in the developing world, they don't have to mirror everything the developed world is doing, because their culture is different. The facilities available to them is different, and they can make use of what they have and get very good results out of it. So that is my submission. Thank you.
Thank you very much indeed, Nonye. That was, you take us from the challenges already into starting to reimagine the solutions, and that provides us with a great bridge to our next presentation by Luciano, which will be in the form of a film, who is asking us to reimagine and to rebuild diagnosis during the pandemic.